Okay, now to the third part of video, a little bit more. Right. So vesicle bullous lesions. So there's vesicle and bullous. You need to know how vesicle look like, how bullous look like. So it's vesicle bullous lesions. Okay. Vesicle bullous disorders are characterized by the formations of fluid-filled blisters which usually burst to leave areas of erosion or ulceration. In addition to the oral mucosa, they may affect other mucous membranes, including genital, conjunctival, esophageal, laryngeal, and many also affect the skin. In broad term, there are usually two main causes. One is infective, and the other is autoimmune. So we've been through infective causes in the infective stomatitis. So in this lecture, it's on the autoimmune. So several conditions which caused by inappropriate productions of antibodies by patients, which is autoantibodies, directed against various constituents. Okay. Examples of the some of the vesicle bullous lesions are pemphigus vulgaris, paraneoplastic pemphigus, cicatrial pemphigoid, bullous pemphigoids, erythema multiforme that we mentioned before, and also lichen planus, which also have the vesicle variant. Right? So you notice that we know about the lichen planus, we know about the erythema multiforme, and this is pemphigus vulgaris, and this is also pemphigoid. So you need to differentiate. Both are vesicle bullous, but what is pemphigus and what is pemphigoid? Actually, it's histologically differentiated where the reactions, uh, autoantibody reactions actually happen. In pemphigus, where do it happen? Within the epithelium, whereas in pemphigoid, so when you say pemphigoid, it's like pemphigus like, pemphigus with OID, pemphigoid. So it doesn't happen within the epithelial, but it's between the epithelial and also the connective tissue. Clinically, this somehow intact and erosion looks like on the skin. This is pemphigus vulgaris, and this is bullous pemphigus. Clinically, it may look the same, but you should look at the histology. Next, other than that, is the traumatic eosinophilic ulcer, still within ulcer, but not recurrent afters. The disorders of this traumatic eosinophilic ulcer, sometimes called TUGE, traumatic ulcerative eosinophilic ulcer. It's disorders of uncertain pathogenesis, not associated with trauma. You may undergo spontaneous remissions after incisional biopsy, maybe 4 weeks after. It affected all ages, most actually female also, but literature says more male, and more at the tongue sides, and similar to traumatic ulcer, but on occasion showed raised lesion resembling pyogenic granuloma. And then you need to know what is pyogenic granuloma, how do pyogenic granuloma look like. And also for the neonates, the newborn, check about Riga fide in patient which is aged 1 week to 1 year, which associate with neonatal teeth. Histologically, what do you see in traumatic eosinophilic ulcer? It's a lymphoproliferative infiltrations with numerous eosinophils. The words eosinophils. So how do eosinophils look like? Eosin means it's like the pinkish, the reddish cells, right? Mast cells, eosinophils. Eosinophils are actually like plasma cells, but the content of the cytoplasm is the eosinophil. I mean, you need to look at this to actually appreciate. Yeah, clinically, traumatic eosinophilic ulcer. So, can you diagnose this clinically? The diagnosis is histology. Last one, median rhomboid glossitis. I know this we've gone through this for the infective stomatitis, but like I mentioned in the lecture before, this is a type of condition that it doesn't simply resolve with antifungal. The antifungal actually shows partial resolutions of the median rhomboidocytis. Normally, it's at the central papillary atrophy, where the marketed erythematous zone in the midline of dorsum of tongue, loss of filiform papillae, symmetrical and often associated, often asymptomatic. Is it a developmental effect? So, yeah, consistent relationship with candida albicans may have candida infection at other sites. Okay. Clinically, looks something like this. Alright, I think that's all within my lecture this time. Thank you for your kind attention, and if you have any questions regarding this or any other lectures, please let me know. Give me